The gender pay gap or gender wage gap is the average difference between the remuneration for men and women who are working. Women are generally considered to be paid less than men. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni Dhar and today we're going to talk about the pay gap of women in healthcare sector, that they earn 24% less than men. Women working in healthcare earn on average 24% less than their male peers and face a larger gender pay gap than in other economic sectors, a joint report by the International Labour Organization and the World Health Organization has found. The analysis, which looked at data from 54 countries across all geographic and income regions, found a raw gender pay gap of around 20%, which jumped to 24% when factors such as age, education, and working time were considered. Gender pay gap also tended to be wider in higher pay categories, where men were overrepresented while women were overrepresented in the lower pay categories. The author said the findings highlighted that women, who accounted for 67% of the global health and care workforce in 2020, were underpaid and undervalued. The article published in British Medical Journal talks about that if we consider the global weighted average of the hourly mean gender pay gap, women in the health and care sector are paid 19.2% less than men per hour worked. In other economic sectors, women are paid an estimated 11.5% less than men per hour worked. The authors highlighted that while some of the pay gap could be explained by the fact that men in the healthcare labor market tended to be older, be more experienced and have more higher education than the women, the largest part of the difference was largely unexplained by available data. They said that part of this unexplained gap could be attributed to a motherhood gap, the measurement of the pay gap between mothers and non-mothers. The report outlined a number of recommendations that could help countries reduce their pay gap. Countries needed to collect and analyze sector-specific wage data frequently and monitor the gender pay gap. Informal jobs in this sector should also be formalized with standardized working conditions between women and men with respect to contracts, for example, offering permanent rather than temporary contracts. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.